I'm talking about meeting the challenges facing midwifery education, and this is basically what I'm going to cover. So I'm going to look at the changing nature of educators over the years. I'm not going to dwell too much on that because I have talked about that before, but I think it's good to recap on that one. Obviously talking about the changing nature of the programme standards and proficiencies, because I keep telling everybody I'm 29. I think it's starting to wear a little bit thin since I've been at Hull 27 years. But over the lifetime of my time in education, I have seen significant changes. And I think it's good to be aware of that. Obviously, the issues facing universities, for those of us who are in universities will know of the challenging times we are facing. So I'm going to look at the university funding and basically look at why we are in this position, the challenges in universities, the challenges in practice, and how we can best meet those. So a bit of a tall order, so I shall crack on. So looking over the time of how we started, and it was actually in our rules. We used to have midwife rules, and you had to have done certain training, you had to have certain years of experience, you had to have done your advanced diploma in midwifery, and because bearing in mind we were state certified midwives then, and you had to do advanced diploma in midwifery and your teacher training, and you became a midwife teacher diploma, which was the MTD. And it was at that point that you could then be appointed as a midwife teacher. So very, very different. When we moved into universities in the mid-90s, this was quite a big change. Change in employer, salary, pension, completely different. I actually did my master's thesis on this, and I actually likened it to an arranged marriage. Talking about, the pillar talk, which was the preparation, the prenuptial arrangement, the offspring, which would be our students, and it all seemed to fit quite nicely with the metaphor. Obviously, the NMC standards have now removed, there is no requirement to be a qualified teacher before you start. The length of experience is also not stated. So what tends to happen is that new lecturers do undertake teacher training and higher degrees on the job. The requirement is also to achieve fellowship of the Advanced HE. We must continue to maintain our registration with the NMC, and obviously the pay in terms is actually compares very unfavourably to Agenda for Change, thinking about recruitment. And I have, for the first time over the last few years, had midwifery lecturers return back to clinical practice because it's better work-life balance and better pay. Now, that is something that really shouldn't happen. That isn't addressed. And also, 50% of midwifery lecturers are over 50. So if we're looking at our professional standards, again, this is a very quick resume, but mid-1990s, so we moved into universities. 2009 became an all degree profession. We had grading of practice at the same time. Revalidation replaced prep. The Triple SA came in 2018. NMC Future Standards came in 2019. We had a National Assessment of Practice document, the MORA in England and Northern Ireland, MPAD in Scotland, and All Wales MPAD. Electronic platforms came in, so we have PebblePad, My Knowledge Map, Pear, ARC, and so many others. And then we had COVID, where if you hadn't already transferred over to Triple SA, it happened carte blanche. The emergency standards did cease in 2001, but it was a lot that happened in a very short space of time that was major, absolutely major. So if we're looking at universities, and as I say, we are in a very unusual position, having worked in universities now since 1990, and I have never ever come across a time like this that I can recall. So I'm going to look at the funding, I'm going to look at student numbers, I'm going to look at research, and I'm going to look at staffing. So funding for universities is predominantly from tuition fees, grants, and contracts for research and teaching. There is direct government funding, but generally the funds are managed as a whole. Research is funded primarily via two primary streams, and this is quality-related performance, thinking of the REF, and grants. Student numbers, obviously, which are a large funding stream for universities, they are currently being affected by cost of living, So students that do start with us, they do tend to suspend because of the cost and the cost of university tuition, which we know the fees are going up for the first time since I think 2012. So that's quite, but it's quite a small amount when you think the inflation is actually 29%. University access and obviously Brexit. I'm not going to get political, but you can't not mention the impact of Brexit on universities. It has led to a very sharp decline in student numbers, withdrawal of Erasmus funding, the decline in student mobility, equal opportunity, and recruitment of European students. This has significantly impacted universities, and also, likewise, because of what's happened on a global scale, the reduction in international students. So already you can see that there is a funding issue. Research, Brexit has significantly impacted European research funding. It's undeniable. EU-funded research projects are becoming much harder to find funding for those working in UK universities. European Research Council, of that, nearly 50% of all UK-based grant winners are nationals of different countries, and many are leaving UK universities due to the lack of security around European collaborations. So again, we have an issue then with funding from research. So universities have got an issue with student funding and research funding. We are investing in PhD study and MSc programs, a lot of pre-registration midwifery programs, and we are ahead of nursing in this field with our master students, which will help with research going forward. But funding for PhD, it's the time, because again, this is on top of the job. So if we're looking at staffing in universities, of course, we've got rising operational costs, capped tuition fees, which has been for several years, as I've just said, and a decline in international student numbers have placed immense pressure on university finances. It's believed this year that 40% of England's universities are expected to run budget deficits. Many universities have been forced to cut staff and cancel courses. There's been job freezes, voluntary and involuntary redundancies across the board. The staff-student ratio, not just in midwifery, this is generic universities, is also under scrutiny. The losses in research funding has made the UK less attractive also to high-quality European researchers and students. Many academics are leaving the UK, believing their vital European research partnerships are not protected. All of this is serving to significantly impact healthcare programmes in universities. This is a position paper from Universities UK, and they have said that the government's ambitious plans to strengthen the NHS can only be achieved if significant changes are made to healthcare education and training now. Almost a third of allied health professionals still in training have considered leaving, with 2 in 5 student nurses and a remarkable 3 in 5 student midwives, which is staggering. So looking at the challenges for midwifery lecturers, recruitment and retention, as I've said, is a problem. Recruitment because of the pay gap. It's undeniable in the cost of living crisis that we are all facing. Who wants to take a £10,000 salary drop? It's just not doable. Pension is different. So the experienced midwives that used to be a requirement is not there anymore. So we are getting fabulous midwives across the board to join our education teams, but they are often not the most experienced. And if we really want to invest in the quality of our registrants, it has to start with the quality in education. And saying this is not, I've got a fabulous midwifery teaching team. Hello, if you're watching. And they're absolutely fantastic. And honestly, what they bring to the team, but it is the longevity. It is the top tier level positions, it is the institutional knowledge, it is the awareness of what's happening, the impact factor, all of those things that when you're doing the job, which, you know, all of our lecturers are, and they're studying at the same time to get the teacher training and to do a master's degree or PhD degree, how much can we possibly ask of them? You know, it is just a big, big ask. Retention, as I say, to the team, our teaching teams, is also problematic. We have had them return, you know, some return to clinical practice, huge loss, fully understand it. Fully understand it. The threat currently of real redundancies, you know, even the threat of it is enough to make people say, I'm going to jump ship. The stress and burnout of meeting all the requirements of the job and the student expectations that Grace has alluded to, which is higher than ever I've known before, because they are consumers. That changed when we came to be a fee, you know, when student fees came in. It changed the whole dynamic. But they are on a professional programme. There's all debates about whether we should be paying for key workers. Why should key workers have to pay to become a key worker? It does make a bit of a nonsense, but that's how it is. And of course, meeting the student expectations is quite time consuming. Of course we do it, and everybody will do it, but it's very, very hard because they are coming with so many more complex life experiences, issues, and what they're seeing in clinical practice is also very different. And of course, the National Student Survey. There's been education, we love the National Student Survey. But it does cause a problem because students do compare and they see what's happening in other universities and think that the grass is greener and not realising actually it's very, very similar. Then you look at the skill mix and, you know, how does that work? If you have got a lot of redundancies, it's usually from experienced staff. So that, again, it alters skills mix considerably. And there is very few, I mean, the Council of Deans, I know that Alison's talking later on, but the Council of Deans have been looking at this for some time, as Jane will know, about the level of top-tier representation in universities for midwives. It is very, very low. In fact, I don't even think, well, Alison will know better than me, if there is actually a midwifery dean anymore. Anywhere, that is anywhere. So if we're continuing looking at midwifery lecturers, of course, we need to recruit our students because that is what we need to obviously keep the university buoyant, to keep our workforce buoyant. It is, as Grace has already alluded to, problematic. We would get students, but because of all the pressures, what they're experiencing, the culture, which is widely reported on, they are struggling. So they will step off, and many that step off do not come back. And so again, it's looking at, because to over-recruit is a problem because we can't place them, but then if we lose them, then we've lost them to the profession, and it takes another 3 years to get that midwife. We have, as LMEs, we have very long discussions on a regular basis about interpretation of the NFC standards. There used to be unambiguous statements of which we followed religiously. They are now outcome focused, which means that they set what they want at the end of it, and how universities interpret it is fine, providing we can evidence that the product is what they want. And that's all well and good, but I've just put in a few really where we're having some discussions about. And one is systematic physical examination of the newborn. Now, the reason I mention that is because with universities we vary as to how many births, how many babies we expect students to actually examine to meet this. Some are 15, some are 50, some are 70, you know, and that's quite a big burden for students, and it is for the clinical staff. So if clinical staff have students from different universities and one set of students need 15 to then have the assessment and another needs 70, that is a big difference. And trying to explain the rationale behind that, you can't. You can't explain it because it's how it's been interpreted. Counting a birth is a huge hot potato at the moment. And, you know, do we count the 40 births? And if they don't have the 40 births because of the changing complexities and the high cesarean section rate, number of students, there's all sorts of reasons given. We have the 30-20 sort of like 30-20 within the standard, if you like, and that can be used to have 30 births, but then you have to have 20 where you have been personally involved. Now, interestingly, the 20 of the 30-20 has criteria that we've all agreed on, but there's no criteria for the 40 or for the 30, providing they personally facilitate the birth. We would like to think that they do look after all 3 stages. That's what the requirement is for the 20. But it's not there, it's how it's counted, because it is actually down to the midwives that they are working with if they count it as a practice experience record. So again, it's all of that difference, and it can be quite different for different students. Practice hours, where do I start? Practice hours, there is so much going on with practice hours. Do we count breaks? Do we not count breaks? How long for reflection time? And again, within universities, there are differences. How do we explain that to students when one university doesn't count practice breaks, but another university does? The students share the same placements. Midwives are confused, students are confused, and both seem to be right at the moment because the standards do not say either or. It's how it's interpreted. We do believe that the NMC are going to make a decision on this for us, and my plea is soon, please, because we have some upset students, for some thinking, well, I work 4 weeks more than the university down the road because they count breaks, but we don't. Why is that? So it's very, very difficult. Simulation and what counts as simulation. In midwifery, we don't count simulation as any practice hours. Nursing clearly do. There's been a huge review on this, a lot of discussion, but again, it's there. And obviously attendance in theory, it used to be state and standards and 100% attendance. Universities, well, certainly in my experience, we used to have an 80% attendance. That is no longer there. So it is how do we ensure that our students are attending, and should we be ensuring our students are attending because they're adult learners? But do we have a professional responsibility? Because if it's timetabled, we believe it's very important that they attend. But can we make them attend? And the argument is, well, just because they're sat there doesn't mean to say they're learning. So there is quite a lot that we discuss. But all of this is actually impacting on the student experience. And of course, students will vote with their feet. And we want them to be competent, we want them to be safe, we want them to be knowledgeable, and it's how best can we achieve that everybody is happy. Because we have to be sure, as LME, we've got a discussion this afternoon on the role of the LME, but I need to be confident that my students have got the required knowledge. But how do we know that? Because we do assess, but we can't assess everything. And as we know, the profession is like this, and it's very different. Again, there's no regulated staff-student ratio. We used to have the 1:10. Oh, it was written in standards, 1:10, nursing was 1:15, and that is no longer there. So if we're looking at the challenges of midwifery practice, again, I'll quickly go on to this one because I'm aware of the time. How am I doing, Jane? Okay, sorry, I'm over. So staffing, I said, significant staff shortages, high levels of stress, reported burnout. It's all in the reports that Grace discussed about. We know that midwives are taking early retirement because of the stress and burnout. This, again, is impacting on skill mix. We have inexperienced midwives supporting students with increased complexity, and there is now the introduction of nurses in maternity, which I know the RCM are looking at. Obviously, understand the NMC standards. A lot of these came in during COVID when midwifery lecturers couldn't go in to support these midwives. Everything was very different. So it's understanding the assessment documents. There's Lindsay, hi Lindsay, who developed the MORA, and we keep asking Lindsay to our meetings because we all have queries and questions that come up in practice from midwives. And it's just working with this. Understanding the new roles of practice assessor, practice supervisor. Midwives are still wedded to mentorship. And there is no denying they are still ready to mentorship. And I think my rationalisation is because it came in COVID. And it was a sudden changeover for many, and it happened overnight. And of course, a lot of our first years were not in practice at the time. And so it was all very different. And we had to then go back and unpick it all to basically start from scratch again. And I think we are getting there, but also came with that with the online platform. And midwives are a certain age, you know, I'm not that techie. I do my best, but PlayStation, I have to give it to my children. How do you turn it off? I have no idea. And I think it is like that. So working with the online platform, getting around the students on the phones, they're not on Facebook. They are actually doing the more. They're doing the pocket, you know, the pocket guide, which is absolutely fine. Of course, recruitment of newly qualified. For the first time last year, we had a bit of an issue with recruitment of newly qualified for all sorts of reasons. And we do know that if students are not employed as soon as they qualify, they are very unlikely to return. So that was a loss. And obviously, I say we do have now, because staffing is affected in midwifery, in universities, that actually doing the link lecture is often the first thing to go, because the priority is teaching in the classroom. That is the priority. And of course, the adverse reporting of maternity services, which is quite demoralising. So we do have strong collaborative working. We do have MSc pre-registration programmes. We are looking to appropriately prepare and educate our midwifery lecturers. We are mindful of this. It's giving them time, but it's a big ask. We do want attractive packages, please, for midwives in education to retain our staff, to recruit the best staff to do this, to recognise the status of midwifery in universities. That is a battle at the moment that I think many of us in universities are facing, because it's a professional card. Some people just don't get it, and it is recognising that we do have standards, we do have regulators, and we can't just fall in line with what happens in universities per se. And if you have a top tier, you know, level of midwives in high positions in universities, they get it. They get it. We would really like an appropriate SSR, please, and financial support for students that's equitable, realistic, and fair. And of course, Grace has alluded to all the global. Oops, sorry. Oh, there we go. So just quickly meeting the practice, as I say, it's all in there. So funding, pathways for other. I know there's Paula this afternoon talking about the advanced midwifery practice. So that's in there. Retention to the midwifery profession, preparedness of workforce, acceptance of report findings. That's what I'm finding now. Safe Learning Environment Charter for England, I say, which now has provided the mindset to address areas of concern. Recognition of staffing, students continue to receive appropriate supervision by appropriately prepared educationalists and practice midwives. That's NMC language, appropriately prepared. That is ambiguous. What is appropriately prepared? We all have different views on that, but we try as LME group to align. So our mission, I think, as educationalists, is for education and practice to provide safe and competent care with compassion, kindness and respect for women and babies and families who access the maternity services, and to all those who work within it. And my plea, please, to our regulator is we need, please, big please, a mandated levers from the regulator to protect the quality of midwifery education, please.